Hey, what's going on, guys? I wanted to show a quick video of 3 different slight variations on a calf stretch or calf and Achilles stretch that I like to use with patients who are working on plantar fasciitis, Achilles tendonitis, or something just similar. Maybe you just got tight calves. Again, always try to think about where potentially that calf tightness is coming from, right? It oftentimes is a tight posterior ankle capsule. So we've got increased, rigidity of the ankle joint. So there's extra work that's having to be done all the time for the peri-ankle musculature to really move that ankle through a full range of motion. Or it's like every time you push off, we're pushing through our own body's resistance before we even, think about pushing the actual body weight up. So you're just adding a lot of friction and a lot of load to that tissue. The other thing, a lot of times I've treated so many cases of plantar fasciitis, Achilles tendonitis from the low back. So if you have increased nervous tissue tone in that lumbar sacral plexus, lumbosacral plexus, and it's coming down the leg, you can think about those lower leg muscles as a sort of meter of dysfunction or a meter of neurotension down the leg. And if those muscles are chronically being elevated in their resting tone, or their working tone via increased neural tension or a neuroagitation from something that's going on up in the lumbar spine, sacral spine, or SI joint, that can really play out into chronic muscle tightness in the calves, soleus, hamstring, that area. So always try to find the why before we just start haphazardly treating. But if we're looking for 3 good ways to really get that ankle area stretched out, this is how I like to go about it. So the first version is going to be a straight leg version that gets more of the gastroc. The next one's going to be bending the knee in, which is going to hit more of the soleus fibers, which probably arguably contribute to a larger portion of the Achilles tendon, or especially more of the anterior portion of the Achilles tendon. And then the last one we're going to do winds up the plantar fascia by getting some great toe extension. We activate what's called a windlass mechanism in the foot, which tensions that plantar fascia and gives us a much more isolated heel cord stretch. But that way we're not, a lot of times we go into our calf stretch, we're falling into pronation and we're really just kind of mashing or stretching out that plantar fascia. If we put it on pre-tension with the foot in a good supinated position, we activate the structural stability component of the foot, and we're not just plying that plantar fascia out into the ground, and we can actually stretch the targeted structures that we're intending to stretch. So all we need is, this is a really nice thing to have, but you don't need to have this. You could just use a textbook or a thick magazine or anything that gives you a little extra elevation of the toe. And we're gonna kind of set it up just about a foot away from the wall. Hopefully this is staying in the, maybe like 2 feet away from the wall. I'm trying to stay relatively close to the wall because I don't have a camera crew and this is tight quarters. But what we're gonna do, if I'm stretching out, I'm gonna stretch out my left foot, just so it's easier for you guys to see. But I want to get into a stride stance. And this is very, very important because the rear foot in a stride stance goes more into supination, especially if the toes are kept straight forward. If you have plantar fasciitis and you're walking around with a foot that is externally rotated, that is your first step. Get that foot straight forward. Because as we're externally rotated, whether that's coming from limited dorsiflexion at the ankle or tight hip external rotators, that is going to severely affect the stress on the plantar fascia. So get that foot that we're going to stretch, get it straight forward. The other foot is going to be out in front of it. Forearms go on the wall, and we're keeping the legs straight for this one. And we're just bending in. You push the heel down towards the floor. Hopefully you guys can see that. And that is our setup. And we're going to hold that for 2 to 3 rounds of 30 seconds. Then what I want to do to get the soleus stretch, I'm going to let that knee fall in just a little bit. And because the soleus doesn't cross the knee, the gastroc does. The gastroc goes more on slack, and we hit more of those deeper soleus fibers. Same thing, 2 to 3 rounds of 30 seconds. Make sure that toe is being kept straight forward and we're not falling in like that and allowing that foot to overly pronate or flatten out. The last version, I'm going to have you pop your shoe off. We're going to look at winding. So we put the great toe and all the toes up against the wall, which again is going to put that
put us more into an arch position at the foot, and then we're trying to gently press our knee forward into the wall, and you feel a good stretch down around the heel cord. So those are 3 quick versions. Again, all of those 2 to 3 rounds, about a 30-second hold. I don't want you going into a lot of pain, and one caveat to just really ensure is that, again, you need to be talking to your provider and know why you're doing these stretches. If you have insertional Achilles tendonitis, these are not going to probably play out well for you. There is a phase of that where I'm okay stretching it, but it still needs to be relatively light, and I don't necessarily want the symptoms to be right at your spot. I want the symptoms to be above your spot, not at that insertional site of the Achilles tendon. And then I feel pretty good about them in that phase to where we're stretching the tissues that are feeding into the attachment structure, and that I'm okay with. But in an acute phase of insertional Achilles tendonitis, these would be contraindicated. So again, make sure you're talking with your provider and you know why you're doing the stretches you're doing. But these are the ones I like to start out with. I've given these to a ton of patients, so I wanted to put a video up on here to just kind of go over the technique and clarify, how we can best use these to address our issues. So I hope this was helpful, and let us know if you have any questions. Thanks.